expand your facility. All comes with money. EcoBank, ever since we came into inception, it has been our bank over the years. In fact, they are our sole bank, the major bank we work with.
Howard Pharmaceuticals have been with EcoBank since 2000. In fact, at that time, I think there were only 4 branches of EcoBank. One in Kumasi, one in Accra, Takwa, and Tema. At that time, Mr. Asian, who is already retired, was the risk management manager of EcoBank. So you can imagine, it's been a very long journey since we've been with EcoBank. And I think that EcoBank has come a long way since the time that we have been engaged with them. It's been a successful and a very fruitful engagement and relationship that we've built over the years.
Yeah, EcoBank gives us total banking services, and we're very happy with the services that we are getting from EcoBank. Actually, we've taken advantage of a lot of their excellent services, such as the PO system, which enables our customers to pay easily, the QR code, making things even more easier. And then we've also latched out onto their OmniLite, that's their internet banking for corporate bodies like us. And this enables us to be able to track all our transactions. We are able to make payments to our vendors, as well as pay salaries to our workers without having to go through the hassle of going to the banking hall. And beyond that, at the end of a period, we're able to carry out reconciliation, which makes our banking life extremely easy, and for this, we are excited.
In recent times, I think EcoBank has come of age in the sense that it's so nice and very comfortable sitting in your office and doing business without you having to travel, without you have to drive to the bank or do anything. I mean, you just sit in your bank, you pay your salaries, you do everything. You are able to pay your customs duty, everything, on the click of the button with their software that they have developed. And I think that is a beautiful thing. It's a wonderful thing.
They have introduced to us the Omni Plus for salary payments, which in fact, one of the things that we enjoy most because it's very fast and just a click. You're able to see everything on your phone because once you have their mobile app on your phone, you are able to see your bank statement, bank account. So as a hospital, like past Community Hospital, this has made payment easier.
We've been working with overdraft facilities. We've never gone for a loan from EcoBank before. Maybe it's because of sometimes our own perspectives and how we look at things. At the beginning, it wasn't even easy to go for an overdraft, but with the support of the managers and the counseling that we've been receiving from the managers and the relationship managers, I think it has reduced the fear that we normally have with going for bank facilities.
Well, sometimes the question is asked, why are you still banking with EcoBank after all these years? And the reason is very simple. We have no reason not to bank with EcoBank. They've been very faithful and loyal to us. They've supported us. And if someone gives you something that you can't find elsewhere, you have no reason to go anywhere else. And that is why we are still with EcoBank. And we're hoping that they are equally going to be loyal to us in terms of support so that our partnership becomes meaningful and purposeful for our mutual benefit.
Talking about how they assist and advise every institution financially to plan for your financial sustainability. They've been there for us. So any other service that EcoBanks offer, we are privileged to enjoy the same thing with them. And one thing that we are happy about is that anytime we call upon them, because of that specialist we have with us, EcoBank is always there for us.
I must say that the managers have been like brothers to me personally. And so our relationship goes beyond, client level. We also normally talk about not only looking at the profits that you get from a client, but there's corporate social responsibility as well. And that's what I always tell the managers of EcoBank whenever we interact. And if you would want to ask me how I can describe EcoBank so far, I can say just one word: reliable.
Our plan for the future is to grow into other segments of the business. We really want to go into large-scale importation of pharmaceutical products, especially need products that this country needs, as well as venturing into manufacturing so that we can bring essential medicines that are needed for our healthcare services right to the doorstep of all the people who need it. And hopefully, in partnership with EcoBank, we should be able to do just that.
I'm a very conservative person, to be honest. And I foresee that we will be with EcoBank for a long haul. And I hope that they will also consider us to be a strategic partner in their business. Yeah.
EcoBank as a financial institution, for our company, like La Paz Community Hospital, that has over 250 staff or employees, it has been one of the most trusted banks we have ever worked with. So in one word, if I may describe EcoBank, it's the most trusted bank in our time so far. Yeah.
Welcome to EcoBank OmniPlus. EcoBank OmniPlus is an improved corporate internet banking platform which allows you to perform banking functions securely and efficiently at your convenience. You can access EcoBank OmniPlus by going to ecobank.com in your web browser, select Corporate and Investment Banking, and click on the Omni icon. You will be redirected to the EcoBank OmniPlus login page. To begin, enter your login ID and your password, and then key in your one-time password from your token device to log in. You'll be presented with a landing page from which you can access the various banking functions of EcoBank OmniPlus. On the landing page are the daily FX rate for our major trading currency. Users can manage passwords simply by clicking on username and then change password. You can click on the widgets button to create shortcuts to your frequently used functions. Your shortcuts will appear below the FX rates column. The various cash management and trade finance capabilities have been categorized into modules that are located at the top of the landing page. The account module provides access to a summary of real-time cash positions, account statements, and the transaction search feature. Reports can be exported in various formats. The Payments module allows you to create beneficiaries securely and perform transactions such as international transfers, statutory and bulk payments, including salary and vendor uploads. The Checks module provides the functionality to manage checks issued on your accounts. Using the Receivables module, you can efficiently collect funds by using bank-verified mandates to debit customers' accounts and credit your corporate account. For clients that wish to automate the movement of funds between a corporate's own accounts, according to predefined mandates such as a target or a minimum balance, the Liquidity Management module may be used. The Supply Chain Finance module provides functionality for the optimization of working capital throughout the supply chain for corporates, vendors, and distributors. You can also access messages and send emails to the bank using the Message Center module. Within the Reports and Uploads module, users can generate customized transaction reports. The Trade module facilitates the initiation of trade requests such as letters of credit, bank guarantees, bills, and trade loans. For specific how-to videos on the various modules, please refer to the other OmniPlus videos. Thank you.
Across Africa, a new era has begun, shifting our focus to a new horizon, connecting us with one purpose: to create and share opportunities to grow. Today, we are making a brighter tomorrow, built by our dreams and our energy. Across our continent, across the world, we are creating a better way to a better future. A Pan-African future, together. EcoBank, a better way, a better Africa.
Topper Pharmacy is a duly registered pharmaceutical company in Ghana. We are retailers, wholesalers of pharmaceutical products as well as services. We noticed that not too many pharmacies were then available, a couple of years ago, and the few that were not offering the services that the people were looking for. We started with just one branch in Tema, but by dint of hard work and following our inspiration as well as our motivation, we've been able to extend our branches to most parts of Ghana.
My name is Dr. Mrs. Beatrice Wiafe Adai. I'm a consultant breast surgeon, the Chief Executive Officer of the Peace and Love Hospitals. They started as a sole proprietor kind of organization, but as we moved on, we realized we needed to expand.
Well, La Paz Community Hospital began as a clinic. That was 17 years ago, somewhere in May 2nd, 2004. Since then, it's been operating as a clinic till it's migrating to full-fledged hospital to provide general health care for the community and its environs.
I'm Eneskusi Abibio, the CEO of PAL Pharmaceuticals Limited. We have been in existence since 1991 May. We have been on the market strongly with our major products. Vitafall, which is the first product we introduced into the country since 1991 and still growing. And other products like Amoxiclav and Nifecat, which we introduced in 2000.
Well, when we started, it wasn't an easy journey. It was quite challenging. Funding was an issue, as well as logistics and all that, but we've been able to overcome much of that. And today, as we indicated, we have branches across the country, and we have seen tremendous growth in our business.
Hospital, we run paperless clinic. You don't carry folders across. Once you enter our premises from the reception, your data is accessed across board in all our consulting rooms, including our laboratories that we run, that we can take care of you without carrying paper around.
But as we moved on, we realized that we needed other units.
We've been very successful with products. They have become household products in the country. Many people know about this. All health professionals are very much acquainted with our products, and they are doing very well on the market.
We started working with EcoBank far back as in 2011. I must say that our friendship has been growing from strength to strength. I've come to have a very good relationship with the managers of EcoBank, and they have been very supportive. The bank managers we've been having, starting from the branch manager to the regional manager, have been like brothers, and they have been very supportive.
Interestingly, EcoBank was the very first bank that we signed up with when we started, because really we needed a partner who could help us along this tedious and arduous journey. And we decided to open an account with EcoBank, and they've been very, very supportive from the very beginning. And that is a couple of years ago. We're talking of about 15 plus years, and we are still with EcoBank till date because we have found their partnership to be useful, and they have also stood by us when we really needed them. And we are thankful to EcoBank, and we still want to continue doing business with EcoBank.
You know, every organization, if you want to grow well, you know, growth, financial aspect is part of the growth. Once you grow in number, you need to make sure you're able to procure and keep things in order, maintenance everything, expand your facility, all comes with money. EcoBank, ever since we came into inception, it has been our bank over the years. In fact, they are our sole bank, the major bank we work with.
Powered Pharmaceuticals have been with EcoBank since 2000. In fact, at that time, I think there were only 4 branches of EcoBank. One in Kumasi, one in Accra, Takwa, and Tema. At that time, Mr. Asian, who is already retired, was the risk management manager of EcoBank. So you can imagine, it's been a very long journey since we've been with EcoBank. And I think that EcoBank has come a long way since the time that we have been engaged with them. It's been a successful and a very fruitful engagement and relationship that we've built over the years.
Yeah, EcoBank gives us total banking services, and we're very happy with the services that we are getting from EcoBank. Actually, we've taken advantage of a lot of their excellent services, such as the PO system, which enables our customers to pay easily, the QR code, making things even more easier. And then we've also latched out onto their OmniLite, that's their internet banking for corporate bodies like us. And this enables us to be able to track all our transactions. We are able to make payments to our vendors, as well as pay salaries to our workers without having to go through the hassle of going to the banking hall. And beyond that, at the end of a period, we're able to carry out reconciliation, which makes our banking life extremely easy, and for this, we are excited.
In recent times, I think EcoBank has come of age in the sense that it's so nice and very comfortable sitting in your office and doing business without you having to travel, without you have to drive to the bank or do anything. I mean, you just sit in your bank, you pay your salaries, you do everything. You're able to pay your customs duty, everything, you know, on the click of the button with their software that they have developed. And I think that is a beautiful thing. It's a wonderful thing.
They have introduced to us the Omni Plus for salary payments, which in fact, one of the things that we enjoy most because it's very fast and just a click. You're able to see everything on your phone because once you have their mobile app on your phone, you are able to see your bank statements, bank account. So as a hospital, La Paz Community Hospital, this has made payment easier.
We've been working with overdraft facilities. We've never gone for a loan from EcoBank before. Maybe it's because of sometimes our own perspectives and how we look at things. At the beginning, it wasn't even easy to go for an overdraft, but with the support of the managers and the counseling that we've been receiving from the managers and the relationship managers, I think it's It has reduced the fear that we normally have with going for bank facilities.
Well, sometimes the question is asked, why are you still banking with EcoBank after all these years? And the reason is very simple. We have no reason not to bank with EcoBank. They've been very faithful and loyal to us. They've supported us. And if someone gives you something that you can't find elsewhere, you have no reason to go anywhere else. And that is why we are still with EcoBank. And we're hoping that they are equally going to be loyal to us in terms of support so that our partnership becomes meaningful and purposeful for our mutual benefit.
Talking about how they assist and advise every institution financially to plan for your financial sustainability. They've been there for us. So any other service that EcoBanks offer, we are privileged to enjoy the same thing with them. And one thing that we are happy about is that anytime we call upon them, because of that specialist we have with us, EcoBank is always there for us.
I must say that the managers have been like brothers to me personally. And so our relationship goes beyond, client level. We also normally talk about not only looking at the profits that you get from a client, but there's corporate social responsibility as well. And that's what I always tell the managers of EcoBank whenever we interact. And if you would want to ask me how I can describe EcoBank so far, I can say just one word: reliable.
Our plan for the future is to grow into other segments of the business. We really want to go into large-scale importation of pharmaceutical products, especially meat products that this country needs, as well as venturing into manufacturing so that we can bring essential medicines that are needed for our healthcare services right to the doorstep of all the people who need it. And hopefully, in partnership with EcoBank, we should be able to do just that.
I'm a very conservative person, to be honest. And I foresee that we will be with EcoBank for a long haul. And I hope that they will also consider us to be a strategic partner in their business. Yeah.
EcoBank as a financial institution for our company, like La Paz Community Hospital, that has over 250 staff or employees. It has been one of the most trusted banks we have ever worked with. So in one word, if I may describe EcoBank, it's the most trusted bank in our time so far. Yeah.
Good afternoon, ladies and gentlemen. Oh, come on. Good afternoon, ladies and gentlemen. Technical team, please. Can you work on my microphone for me? Two. All right, thank you so much. Ladies and gentlemen, one more time, good afternoon to you and welcome to a day where we actually launch an event that seeks to, that seems to project and enhance the access of pharmaceutical services in Ghana. Please, if you're happy to be part of this particular event, a round of applause for yourselves. I think I can only hear from this side, and this side. You're not really giving me the vibe. Thank you so much. Today, we are only not here to actually launch a project, but we are here to make sure that pharmaceutical services in Ghana is actually a top-notch hire. And so one more time, I would want to welcome you. But just before we get into business, I would want to welcome, or help me welcome, Dr. Pharmacist Dennis Sena Awiti, the Executive Secretary of Pharmaceutical Society of Ghana, with a round of applause as he gives us the introductory address.
Thank you very much, Mr. MC. It's a privilege seeing all of you here, and I want to especially welcome all the invited dignitaries and our Sector Minister, Honorable Bernard. Dr. Bernard Okuboy is out of town, but he's asked the newest deputy to be with us, so she'll be introduced in due course. So I especially welcome her. I also welcome all members of the governing board of the Pharmaceutical Society of Ghana here present. I want to also acknowledge the presence of the Dean of the School of Pharmacy, University of Ghana, Professor Jechi, Director of the Ghana College of Pharmacists, the Rector of HEFRA is also here, the Chairman of the Pharmacy Council, Mrs. Doris Fosuhima Adeafokwa, and our partners, all our partners. You can see them here from Medical Credit Fund, EcoBank, who's hosting us graciously, Worldwide, who is the first pharma company to come on board because they are committed to the vision, Ghana Cooperative Credit Pharmacists, UBA, and all the other banks, including Prudential. Many more will come on board because this is a very important program for us. It's part of the strategic plan of the Pharmaceutical Society of Ghana to ensure that we develop strategies that can enhance access to pharmaceutical services all over, because we know that the biggest cities will have no shortage of community pharmacists. But then how can we devise strategies to make sure that we get pharmaceutical services into the hard-to-reach areas? That is why we are here, and through the power of technology, we are launching this today. It's my prayer that you all support it and we can go far with this. We thank the media for their presence, and we know that as we launch it, they'll carry it far. And this is just to break the ice and to let you know the purpose for this gathering. And once again, thank you for coming. God bless us all.
God bless us all. Thank you so much, Pharmacist Dr. Dennis Sena Awiti. Ladies and gentlemen, now that we've actually introduced our special guest and every other person that matters when it comes to the matter of Pharmaceutical Society, I would like to introduce myself. My name is MC Dela, and I'm going to be your host for today. Very soon we are going to get into real business, but thank you so much for sticking with us. We know we promised you to start an hour ago, but we've not started it. Kindly bear with us. We are actually making sure that this program runs very smooth. That is why it has delayed a little. There is actually an Akan adage that says, so please kindly bear with us. We will come back. But in the meantime, we have an organist in the house. He will be entertaining us with some good interlude. And when we come back, we will get into business. One more time, thank you for coming. My name is MC Dela.
kasitne beyedenkra obranu yeding pa naswadunu dimikaida nyami wadumyi na shema be sine adumni ehumobro nedima bedruhane nyami yewaduma kasitne beyedenkra obranu yedimpa naswadum nudimikaida nyami wadum nashema besine. You never gave the promise that the journey would be easy. Your grace and mercy has brought me thus far. Your grace and mercy is all I need. Your grace and mercy has brought me thus far. You never gave the promise that the journey would be easy. Your grace and mercy has brought me thus far. Your grace and mercy is all I need. Your grace and mercy has brought me thus far. Dromosa, 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 ke wabonale. Your grace and mercy has brought me thus far. Adum ni humobro nedima bejuhane. Your grace and mercy has brought me thus far. Dromosa, 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 ke wabonale. Your grace and mercy has brought me thus far. Adoni humobro nedima bejuhane. Your grace and mercy has brought us this far.
Ladies and gentlemen, one more time, let's do it better for our organist for today. I told you that very soon we will be getting into business, and now is the time. We can't actually come to the house of a man and not hear from him. So, ladies and gentlemen, the gentleman I'm about to introduce to you is the president of the Pharmaceutical Society of Ghana and the chief executive officer and chairman of Cedar Point Chemist Limited. He holds a Bachelor of Pharmacy degree from KNUST and an executive master's in business administration from the University of Ghana Business School. He was the president of the Pharmaceutical Importers and Wholesalers Association of Ghana. He is a member of the governing board of Pharmacy Council of Ghana and also a board member of the Ghana College of Pharmacists. He has served as a director of membership and service project for Rotary Club of Accra Ring Road Central. He is also a sports enthusiast with a special interest in soccer and tennis. Ladies and gentlemen, this gentleman's reputation exceeds him. Please help me welcome with a round of applause Dr. Samuel Eko Donko, President of the Pharmaceutical Society of Ghana. Sir, just before you start talking, I hope the recent loss of Dortmund didn't actually affect you that much in the Champions League.
Actually, I'm a Madrid fan, so I'll go for Hala Madrid. I've always supported Madrid in Champions League. And there's a simple reason. My beloved club, Arsenal, has always failed when it comes to Champions League. So I have Real Madrid always on my side when it comes to Champions League. Thank you. Honorable Deputy Minister for Health, Honorable Member of Parliament for Insuta Kwaman Beposo, Honorable Adelaide Intim, representing the Minister of Health today, Director of Pharmaceutical Services, Ministry of Health, the Director of Pharmaceutical Services of Ghana Health Services, Chairperson of the Pharmacy Council of Ghana, Registrar of HEFRA, the Rector of Ghana College of Pharmacists, the President of the Pharmaceutical Importers and Wholesalers Association, members of the Governing Board of the Pharmaceutical Society of Ghana, colleague pharmacists, project partners, esteemed members of the media, ladies and gentlemen, good evening to all of you. And I would like to begin by extending my appreciation to all our invited guests and every one of you for making time to be part of this event, both in person and those who have joined us virtually. It is with great pride and enthusiasm that I stand before you today to launch a transformative initiative that marks a significant milestone in our commitment to enhancing healthcare delivery in Ghana. Today, we unveil the strategy for enhanced access to pharmaceutical services, which in short will be called SEAPS, a project designed with the needs of the Ghanaian in mind. The United Nations Agenda 2030 emphasizes good health and human well-being in achieving sustainable development goals. Equitable access to healthcare is a fundamental goal of the Sustainable Development Goals. In a world where health is our most precious asset, the availability of life-saving medication should be given, not a privilege. Should be a given, but not a privilege. However, we are acutely aware of the challenges many Ghanaians face in accessing essential pharmaceutical services, particularly in underserved areas. These challenges are not just barriers to health, but are obstacles to the overall well-being and development of our communities. The SEAPS initiative aims to bridge these gaps through the strategic extension of pharmaceutical services to areas that need them most. The prominent double burden of persistent communicable diseases and increasing non-communicable diseases has resulted in a huge cost for the country to maintain the healthcare sector. The government of Ghana has committed to achieving universal health coverage and increasing access to essential health services. This is reflected by the Ministry of Health's Midterm Development Plan 2022 to 2025 to increase access to quality essential health care and population-based services for all by the year 2030. Ghana has also committed to the Abuja Declaration in 2001, which is to spend 15% of government's budget on health. Honorable Minister of Health, how well are you doing on that? Deputy Minister on Health. The government spending plans over the years, however, indicate that health spending falls as a percentage of the budget and GDP. And the health spending is a proportion of government spending in 2019 stood at 8.1% of the budget, while the forecast for an increase from 7.6% of the budget in 2022 to 8% in 2023 is set to fall back to 6.5% in 2025. Given that this comes at a great time of fiscal consolidation, we therefore consider that government spending will definitely fall short of the Abuja Declaration going forward, especially under the IMF times. A number of factors could account for this. Ghana, like other least middle income countries, has experienced a dwindling and irregular inflow of donor support to finance the health sector. With the current economic situation, Ghana must explore avenues to improve domestic resource mobilization and ensure sustainable health financing. In addition, Ghana must examine the healthcare system more inclusively to leverage on existing infrastructure and systems to expand access to healthcare. This way, the country can leverage the untapped potential of community pharmacies and create a more efficient and effective healthcare delivery system. Pharmacies hold immense potential as primary care providers, where they can significantly enhance the provision of primary health care. Their widespread accessibility within the communities allow highly trained pharmacists to advise on health management directly and promptly. The emphasis here is directly and promptly, making healthcare more immediate and personalized. Internationally, the potential of pharmacies to meet healthcare needs and support specific health policy objectives is increasingly recognized. Integrating pharmacies as core components of primary health care leads to a more effective, efficient, and patient-centered system. Policymakers, which we are lucky enough to have many of them here, must consider universal pharmacy coverage as an integral part of universal health coverage to fully realize these benefits. This project is not about pharmacists. It is about the well-being of the Ghanaian people. It is about the mothers who travel long distances to get medication for their children, the elderly who need timely access to their prescriptions, and every individual who deserves the right to quality health care. SEAPS is our pledge to make a tangible difference in their lives. Through dedicated funding and technical support, we will empower pharmacists to deliver services more efficiently and effectively. We will create a robust network that ensures that no one is left behind, reinforcing our commitment to equity in healthcare. We are thrilled, therefore, to launch the SEAPS project aimed in enhancing access to pharmaceutical services in our most deprived and underserved communities by providing financial and technical support to pharmacists, especially the young pharmacists. SEAPS will enable them to establish and expand pharmacies, ensuring that quality pharmaceutical care reaches those who need it most. With the integration of advanced technology, we are committed to improving pharmaceutical care, documentation, and referral pathways. By empowering pharmacists to establish and expand their practices, especially in underserved areas, we are directly addressing inequalities in healthcare access. In addition, the Pharmaceutical Society of Ghana is committed to reaffirming the indispensable role of community pharmacy as primary healthcare centers. One study reports that more than 80% of Ghanaians utilize community pharmacy services for what they consider as minor ailments and what I will consider as basic diseases. Consequently, the community pharmacy network has the potential to provide a greater number of people with primary healthcare services, especially where access to other healthcare facilities is low. Thus, efficient distribution of community pharmacies has several major implications regarding healthcare access and equity amongst the poor, such as alleviating patient travel distances, addressing the health disparities in the underserved areas, and the development of a more resilient and responsive healthcare system. I'm immensely grateful to all our partners. We can't have gotten to this far without the partners that we have. All our financial partners, all our pharmaceutical distributors partners, and the technology partners who have made it possible. Through your support and collaboration, we have made this vision a reality. Together, we embark on this journey to enhance the healthcare landscape of Ghana, fostering a future where essential medicines are accessible, affordable, and available to all. Making it simple, to the Pharmacy Council, that the chairperson of the Pharmacy Council is here, you have the mandate by law to ensure equitable distribution of pharmacies across the country. Through the SEAPS initiative, Madam Chairperson of the Pharmacy Council, we would help ensure the equitable distribution of pharmaceutical services across the country. And we'll be counting on the Pharmacy Council when we put in the applications to help pharmacists be able to get access or be able to open their pharmacies. A speedy resolution. The Honorable Deputy Minister of Health representing the Minister, we are also asking you to accept and make a policy to make community pharmacies a primary health care center or be a primary health care point, such that diseases, basic diseases or disease of common ailments can be treated and even passed on to the NHIA for NHIA to pay and reimburse. We are asking that this recognition be given to enable the patients not travel to seek treatment or remedy for conditions like malaria, conditions for maybe basic coughs, and other conditions that could easily be handled by the pharmacists. Why be in a queue? Why travel long distance when simple basic diagnostic tests could be done? RDTs are available, malaria testing can be done. Once confirmed, treatment can be done. NHIA can do the reimbursement appropriately. And the pharmacists will be rewarded by being given the requisite service fees. This is what we are asking policymakers to do for us. Mr. Hefra, Registrar of Hefra, you are here, and we hope that through this launch, you will integrate the community pharmacy as part of the primary healthcare delivery centers in this country. And together, we would make lives better for our people. The two Directors of Pharmaceutical Services, policymakers, we appeal to you that make sure as part of your policy, community pharmacies become a primary healthcare point. Ladies and gentlemen, thank you for your time.
Ladies and gentlemen, can we do a better one for him as well? Because we are far behind time, ladies and gentlemen, we are going to be calling on our speakers just immediately after the other. So kindly help me as I introduce to you a woman who holds diploma in pharmacy and basic criminal law from the United States of America. She also holds a certificate in leadership and management from Ghana Institute of Management and Public Education. She has over 15 years work experience as a professional health worker in the United States. Ladies and gentlemen, she is also the Member of Parliament for the good people of Insuta Kwamam Beposo constituency in Parliament. She serves on the please, excuse me, I'm so sorry, let me take it again. In Parliament, she serves on the Select Committee on Foreign Affairs and Government Assurance Committee. As the Deputy Minister, she has oversight responsibility on the following: Traditional and Alternative Medicines Directorate, National Ambulance Service, Health Training Institutions, Human Resource for Health Development, Nurses and Midwifery Council, and the National Blood Bank. The National Blood Bank Service. Thank you. I think there are some errors here, but please pardon me. She's also a member of the Ghana Cylinder Manufacturing Company Governing Council, Population Council Board. She is a woman who is passionate about women empowerment and an advocate for children and people living with disability. Ladies and gentlemen, please, with a round of applause, help me welcome Honorable Adelaide Intim. With a round of applause, please.
Thank you, and good evening to you all. The President of Pharmaceutical Society of Ghana Pharmacy, Dr. Samuel Kodonko, representative of the Director General of Ghana Health Service Pharmacy, Dr. Dominic Autry, members of the Pharmaceutical Society of Ghana Governing Board present, the Registrar of the Pharmacy Council, Dr. Daniel Ameni Danko, distinguished invited guests and representatives from various pharmacy organizations, our cherished pharmacists, partners of strategy to enhance access to pharmaceutical service, SEAPS, the media, ladies and gentlemen. It is a great honor to join the Pharmaceutical Society of Ghana and partners at the launch of the strategy to enhance access to pharmaceutical service SEAPS project. It must commend your leadership for such an initiative, which undoubtedly represents a significant leap in our collective effort to strengthen healthcare delivery across the nation. This project and the deliberate effort of the society to position pharmacists and pharmacies as primary healthcare providers are timely as they complement the recently launched implementation guidelines for the network of practice by the Ghana Health Service. These initiatives aims at addressing systemic challenges in healthcare delivery and to build a long-term primary healthcare model that supports universal health coverage in Ghana. It is important for fostering collaboration among health providers and ensuring timely access to quality essential services. The SEAPS project aims in supporting and establishing new or expanding existing pharmacies offering financial and technical assistance. It focuses on establishing pharmacies in underserved communities, providing technological solutions for smooth pharmaceutical care. This objective definitely support the vision of the network of practice, and the ministry assures its unwavering support to make this work. Ghana's World Centers initiative offers an opportunity to leverage the existing network of community-served pharmacies, extensive presence, accessibility, and extended hours. These pharmacies, staffed by trained healthcare professionals, can serve as convenient points of care, increasing participation in preventive health measures. By transforming pharmacies into wellness centers, Ghanaians can receive vital checks, consultations, and health education in their reachable communities. The increased complexity of patient health needs and treatment plans necessitate access professionals capable of overseeing medication therapy, detecting adverse events, and handling drug-related issues. Ghana faces a double burden of communicable and non-communicable diseases, compelling intensive primary care and accessible healthcare professionals to ensure quality prevention and treatment. Pharmacists with their training and qualification can address these gaps in medication management within the primary care settings. The imperative to expand access to primary care requires the healthcare system to be more inclusive, incorporating all ANSYS primary healthcare providers in delivering chain. Innovative solutions should focus on supporting quality care to all patients using advanced informatic and quality improvement initiatives and involving interprofessional teams. The growing gap between primary healthcare providers and unmet patient needs in Ghana healthcare system to raise significant public challenges. These complex issues require coordinated efforts by all professionals to find solutions and deliver high-quality team-based care. Resolving these challenges, pharmacists can play a vital role in identifying untapped resources and enhancing access to primary care while also addressing medication management and challenging aspects of patient care. The SEAPS Project 6 to empower pharmacists to establish and expand practices, especially in underserved areas, to address access inequalities. These initiatives support the broader goals of providing high-quality pharmaceutical service to every Ghanaian, regardless of location. Pharmacies are crucial in primary health care, and integrating them can enhance patient outcomes, reduce costs, and improve public health. The strategy to enhance access of pharmaceutical service, network of practice, and the wellness center initiatives will be key components of our strategy to overcome current healthcare challenges and achieve our universal health coverage goals. They provide a framework of enhancing capacity of healthcare providers and ensuring that services are accessible to all. I want to commend the Pharmaceutical Society of Ghana and all collaborating partners for the successful launch of this visionary SEAPS project, which is crucial for building an inclusive, equitable, and high-quality healthcare system. Let us all reaffirm our commitment to supporting pharmacists and integrating them into our primary healthcare model to ensure access to pharmaceutical services for all citizens. In conclusion, I urge all stakeholders to rally behind the SEAPS project. Together, we can create a healthcare system that truly serves all Ghanaians, achieving our vision of health of all kinds, making significant strides towards the sustainable development goals. Thank you for your dedication and commitment. Let us continue to work together to build a healthier and more resilient Ghana. Thank you.
Let us help a more resilient Ghana, please. Let's give it up for her one more time. Next, to give us a special address, ladies and gentlemen, please help me welcome Dr. Dominic Otre, the newly appointed Director of the Pharmaceutical Society of Ghana. Okay, I think I got the wrong information once again, but ladies and gentlemen, please, let's welcome Dr. Dominic Otre with a round of applause.
So, sorry for the mix-up. So, pharmacist Dr. Dominic Otre is the newly appointed Director of Pharmaceutical Services for the Ghana Health Service and is here representing the Director General of the GHS. Let's welcome Dr. Dominic Otre.
All right, thank you very much for the correction. I don't fit to be president of the Society of Ghana, so I'm very happy that that correction was made. Good evening, all of us gathered here. Good evening. Good evening. The president of the Pharmaceutical Society of Ghana, Dr. Samuel Eko Donko, Rector of the Ghana College of Pharmacy, the Registrar of the Pharmacy Council, Honorable Deputy Minister of Health, the Chairperson of the Pharmacy Council, the Director of Pharmacy, Pharmaceutical Services at the Ministry of Health, are often referred to as Evergreen Joycelyn Aziz. Members of the pharmacy fraternity, colleague healthcare professionals gathered hearing, invited guests, ladies and gentlemen, members of the press, both electronic and print, and also members of the security agencies without whom we could have organized this meeting. Once again, good evening to all of us. Kindly permit me to stand on the existing protocols of this lawfully constituted assembly to extend warm greetings from the Director General of Ghana Health Service, Dr. Patrick Kuma Abuaji, to this august house. The Director General, whom I describe as a friend of pharmacy, was eager to be present here himself this evening to witness the launch of this new initiative dubbed SEAPS, but could not because he's presently attending to an equally important national assignment. This notwithstanding, I would like to assure us that he's here with us, both in spirit and in mind. As was indicated in the invitation letter, the mission of the Ghana Health Service is to provide health services responsive to the needs of all residents in Ghana by implementing approved health sector policies for health service delivery in the country, to increase access to priority health services and manage prudently resources available for the provision of health services. This mandate aligns with the SEAPS project, which aims, amongst other things, to address the critical issue of access to pharmaceutical service, particularly in the underserved areas of Ghana, with emphasis on primary health care. The fact remains that weak governance and management of pharmaceutical services, resulting from inadequate pharmaceutical human resource, especially in the rural and deprived areas, results in the delivery of substandard pharmaceutical care with major deficiencies in both the most basic and essential pharmaceutical services. Primary health care has traditionally been the chief cornerstone of the national healthcare system in Ghana. And thus is fundamental to the structure of the country's healthcare system. In fact, it is estimated that 75 to 85% of people in the general population require only primary healthcare services each year. The Ghana Health Services, being the largest service delivery agency of the Ministry of Health, stands at the forefront of national efforts to achieve universal healthcare coverage for all residents in Ghana, which includes financial risk protection, access to quality essential health services, and access to safe, effective, quality, and affordable essential medicines and vaccines as enshrined in Ghana's Universal Healthcare Coverage Roadmap 2030. Through the years, Ghana has undertaken major steps to improve health outcomes, particularly by strengthening primary health care. Some of these steps include committing to the primary health care strategy as far back as 1978, adapting the community-based planning and services, what is normally known as SEAPS, the CHIPS concept or the CHIPS strategy, in 1999, and implementing the community scorecard in 2018. The past 2 decades, however, have seen Ghana strengthening UHC by investing in district hospitals and operating CHIPS compound. Less investment was provided in health centers, which inadvertently broke down the critical referral link between the community and the district health services. As a result, health centers became the weakest link in health service delivery. As of 2018, only 43% of health centers were fully equipped to provide primary health care. Cognizant of the breakdown of Ghana's gatekeeper system, the Ghana Health Services has proposed to upgrade health centers into model health centers and set these facilities as a hub of networks of sub-district facilities. The networks of practice, which I'm very happy that the Deputy Minister spoke extensively about, reinforces the commitment of the health sector to identify innovative approaches to increase access to quality essential healthcare and population-based services for all. In fact, this is in line with the strategic focus to achieve universal healthcare coverage by the year 2030. Ghana's primary healthcare strategy remains the bedrock of our approach to achieving universal health coverage with the focus of improving health outcomes. Thus, the Ghana Health Service, with support from development partners, is determined to facilitate and initiate the rollout of 330 networks of practice facilities nationally in the days to come. And pharmacists and over-the-counter medicines sellers are expected to be part of this network. Pharmaceutical services refers to services pertaining to pharmacists and pharmaceutical support staff in approved premises and the conditions under which those services may be provided. This encompasses the procurement, dispensing, counseling, distribution, storage, and control of all pharmaceuticals within the facility, and the monitoring of patients' drug therapy. Pharmaceutical services is a critical and indispensable component of health service. Because I've always maintained that health service is incomplete without pharmaceutical services. And access to quality, safe, and affordable essential medicines is a key index used in measuring and monitoring progress towards universal healthcare coverage. Community pharmacists remain the first point of call, and I'm the third person to re-emphasize this fact this evening. They are serving as the point of entry into our national healthcare system, bringing health services delivery as close as possible to where people live and work. Healthcare professionals, healthcare systems of most countries, including Ghana, have a problem that needs the attention of pharmacists if it is to be solved correctly. And the problem is poor quality of medicines use. And the solution includes increased pharmacist participation in medicines management. Studies from many countries conducted over the years have shown the need for better management of drug therapy. It's been realized that it results in fact, it's been realized that there are so many challenges with drug therapy management, and this includes inappropriate prescribing, which often results in drug diagnosis mismatch. And that is a leading cause of NHIS deductions for most of our healthcare facilities across the country at all levels. Inadequate monitoring and advice, patient non-adherence to drug regimen, and then the prevalence of adverse outcomes of drug therapy. Mismanaged drug therapy may rank as one of the leading causes of hospital admission because of adverse reactions, under-treatment, and non-treatment. The possibilities of safer and more effective drug therapy management have been clear, and the evidence is mounting about how to improve them. When pharmacists systematically cooperate with patients and other healthcare providers with the objective of improving the outcomes of drug therapy, outcomes often improve and cost often decrease. Pharmacists have the potential to improve therapeutic outcomes and patient quality of life within available resources, and must position themselves at the forefront of healthcare systems. Over the past 40 years, the pharmacist's role has changed from that of compounder and dispenser to one of drug therapy manager. The practice of pharmaceutical care is new, in contrast to what pharmacists have been doing for the years. The knowledge base of pharmacy graduates is changing with the training of PharmD pharmacists and recently specialist pharmacists. As these graduates move into practice, so must pharmacy practice change to reflect the new knowledge base. Let me use this August platform to commend the Pharmaceutical Society of Ghana for efforts to bring health service delivery to where people live and work. I expect my office to be provided with regular updates of the outcome of this noble initiative through the Director of Pharmaceutical Services in Ghana Health Service. May God bless our homeland Ghana and make it great and strong. Long live Ghana, long live PSGH, long live the SEAPS project. Thank you very much.
Ladies and gentlemen, one more time, please, let's do it for the gentleman. Sir, please, I would like to apologize for the mix-up earlier. Kindly forgive me. Thank you. But we need to take another address from our very own Piwa. Ladies and gentlemen, to give us this address is the president of Pharmaceutical Importers and Wholesale Association. Please help me welcome with a round of applause, Dr. William Itum Ado.
Please allow me to stand on all protocols already established by my distinguished earlier speakers. Good afternoon, distinguished ladies and gentlemen. It is a delight and privilege to address such a gathering of great minds, of businessmen and astute professionals of diverse disciplines at this launch of SEAPS project, a strategy to enhance access to pharmaceutical care. The practice of pharmacy in Ghana began several decades ago, during which dispensing certificates were awarded to a few health practitioners for the sole purpose of assisting doctors to dispense medicine to patients, which later metamorphosed into award of diplomas, then BPharm. Today, the pharmacy profession has grown and matured, and in the last decade, training institutions in Ghana have started awarding Doctor of Pharmacy degrees, PharmD. The pharmacy profession currently has a lot of alumni in education, health, technology, and research institutions, business, community pharmacies, and in various capacities, contributing their quota and excelling all over the world for the good of humanity. Amicus Humani Generis, friends of the human race. Also, pharmacy-owned pharmacies keep growing, and I give thumbs up to the leadership of PSGH for the SEAPS project, financial institutions, and other partners who ensure this dream of the SEAPS project become a reality through flexible financial schemes for the establishment of community pharmacies by pharmacists as part of PSGH strategic plan. This SEAPS project will also ensure that underserved community pharmacy areas in Ghana are also well covered. As president of the Pharmaceutical Importers and Wholesalers Association of Ghana, I wish to assure all partners involved in this SEAPS project that our members will fully support this project, and we will collaborate fully to ensure this great SEAPS project become extremely successful. Mr. President, as trained and practicing pharmacists, whose primary role is to ensure access to safe, cost-effective, and quality medicines, we hold it a duty to ensure we are not left behind in this contemporary, ever-changing world. Enhancing access to pharmaceutical care is crucial in our world today for improved patient outcomes and overall health delivery in our dear nation. Kindly permit me to outline a few points to consider if we want to enhance access to pharmaceutical care services. Firstly, digital transformation has come to stay, and as pharmacists, we owe it a duty to ensure we take advantage of platforms such as telepharmacy, telehealth, and other online health and pharmacy platforms to reach a wider patient base. Also, technology for efficient inventory and financial controls can be applied at the community pharmacy by partners to know at real-time cash flows for participating member facilities. This technological advancement can enhance access to medications by providing remote consultations, medications delivery, like in the case of Zipline. During the COVID-19 pandemic, when movement to pharmacies were curtailed due to lockdowns, the use of technology made it easier for medications to be delivered to patients' doorsteps. digital technologies are driving a massive shift in the world of pharmacy, with the primary aim of improving productivity, efficiency, and flexibility in global healthcare delivery, and we in Ghana cannot afford to be left behind. Moreover, a patient-centered approach is essential. By prioritizing patient needs and preferences through tailored treatment plans based on individual characteristics and medical history, we can significantly improve patient outcomes. Personalizing medication therapy through comprehensive medication reviews, known as medication therapy management, MTM, ensures optimal use of medications. Additionally, detailed patient counseling on medication use, potential side effects, and adherence is crucial. Furthermore, personalized counseling and education can be achieved through regular patient engagement and discussions about their medicines and potential side effects. Addressing possible misconceptions about the practice of pharmacy and regularly assessing patients' responses to medications and feedback are also key components of this approach. Strengthening the health system is another critical area. This can be achieved through collaboration with relevant stakeholders and partners to address governance, human resources, information, finances, and service delivery functions with a focus on medicine. Also, enhancing our procurement systems, pricing, and regulation of medicines ensures a consistent supply of pharmaceutical products at affordable prices. Again, investing in capacity building by training more providers and pharmacists to deliver excellent pharmaceutical care is necessary. Continuous professional development, encouraging pharmacists to pursue ongoing education, and promoting specialization, as we're already doing in fields like oncology, geriatrics, mental health, diabetics, cardio, just to mention a few, will enhance our capacity to provide high quality care. Also, an effective national health insurance scheme is essential. Successive governments should make deliberate investments and also ensure the NHIS is fully equipped and running to ensure equitable access to medicines. However, uncontrolled mining chemicals that pollute our water bodies and soil and improper agrochemical applications have the application to enter the food chain or through direct consumptions through various pathways, posing significant risks to both environment and human health, which can cause acute or chronic health issues such as poisoning, neurological damage, reproductive issues, kidney failures, and cancers. Also, long-term exposures to low levels of toxic chemicals can cause developmental problems in children, hormone disruptions, and other chronic health conditions. Effective regulation, advanced technologies, and active remediation efforts are essential to mitigate these risks and protect ecosystems and public health. If not, it can bring severe pressure on the NHIS and individuals' finance, as more people get treated at a very high cost, and hence the budget for medication will also go up for patients and country at large. We are all at risk. As the government works to increase health funding, it is crucial to address these environmental health hazards to prevent additional healthcare costs related to pollution-induced conditions. Furthermore, expanding pharmacists' role in primary care, including running certain diagnosis tests and consultations, as the President mentioned, will enhance their contribution to patient care. Again, promoting interprofessional collaborations between pharmacists and other health professionals will ensure effective teamwork to optimize patient care. Finally, we must advocate for policy changes to expand pharmacists' scope of practice and work towards reimbursement models that recognize and compensate pharmacists for clinical service beyond just dispensation of medications. I wish to conclude by saying, together, we can make SEAPS project happen for the benefit of all. Long live SEAPS projects, long live PSGH and her partners, long live Mother Ghana. Thank you.
Ladies and gentlemen, we can still do a better one for him. It is now time for the moment we have all been waiting for. Yes, the official launch of the strategy to enhance access to pharmaceutical services. Today, not only are we launching, but we are also taking pharmaceutical accessibility a notch higher. So please, if you're happy to be a part of this, one more time, a round of applause for yourselves. With that being said, ladies and gentlemen, I'm going to invite certain people to join me as we launch this. First of all, I would invite the president of the Pharmaceutical Society of Ghana to join me. Sir, please do us the honor. I would also invite the deputy minister to join me as well. A chairperson, Pharmacy Council, please join me. A representative from the Director General, please join me as well. Registrar of HEFRA, please join me as well. President of PIWA, please join me. Chairman of CPPA, please join me. And the Rector of Ghana College of Pharmacists, please join me as well.
Okay, thank you. I think I will also ask any other governing board member of the Pharmaceutical Society of Ghana to join us. A journey that started over a year ago, working, finally has come to a point where we can launch this project. I want to inform all pharmacists in this country, wherever you find yourself, that the SEAPS project is for you. Pharmacists owning their own pharmacy, wherever you find yourself, make yourself available. Take advantage of the SEAPS project. This is a project for you in order for pharmacists to be able to offer pharmaceutical services across the entire nation. On this particular moment, with all the dignitaries around me, behind me, my single honor to officially declare that the SEAPS project has been launched. With the full support of all the dignitaries, I would want to officially once again say that the SEAPS project has been launched and is going to make a bigger impact in order to ensure that pharmaceutical services is extended to every part of this country. Thank you.
And so thank you very much. Please, let's give it up for our leaders who actually launched this for us. At this point, we need to take an address for a rep from the Medical Credit Fund. If you're here, please join me. Please, let's give it up for the gentleman.
Honorable Deputy Minister, and as other speakers have said, I stand on existing protocols. My name is Joseph Ansinade. I'm the director for the Medical Credit Fund. The Medical Credit Fund is part of pharmacists. And our pharmacists, our aim is to ensure access to quality or better health care. And MCF, or Medical Credit Fund, was established in 2009. And we have offices in Netherlands, Kenya, Tanzania, Nigeria, Uganda, and a few other African countries. Most of the SMEs in health find it difficult to access financing to ensure that they operate well or optimally. So MCF fills in the gap to ensure that there is financing. And the SEAPS or the SEAPS project, we've accepted to be partners, and we also ensure that all the community pharmacists and other businesses or related businesses get enough funds to operate successfully. MCF has 2 loan products. We have a normal term loan that you all know. One key aspect of our loan is that we ensure quality through safe care. Safe care is also part of the pharmacist family, and we ensure that not only do business operate with financing, but they get technical support to ensure quality and also to ensure business improvement. At MCA, before I finish, we also have another flagship loan we call digital loans for community pharmacies that operate or will be operating and they will be collecting money through digital platforms. It can be Momo, it can be Airtel, it can be whatever, even through the card system. We also have another loan product where you will not be paying conventionally through, let's say, check or a normal loan installment, but as people visit your pharmacy businesses to buy, and they also pay through Momo or whatever means, portions will be hived to us as a form of repayment. And we do that with a fintech partner, Cowry. I think we have a rep of them here, and we ensure that you qualify for a loan and you pay it without even knowing that you are supposed to pay a loan. We salute all of you, and we hope that all in Sundry will buy into this project and ensure that we are successful. Before I sit down, I want to announce that we are part of those outside. I have a team of experienced business advisors who will also help you to ensure that you get closer to us. Pharmaceutical Society of Ghana is already our partner. The CEO or director for IFRA is also here. They know most of us. And we ensure that we partner all of you so that we get funds to operate for this project to be very successful. Thank you very much.
Please, let's do it better. He said he will make sure we get funds for this project to actually operate. So please, I think we can do it louder, because funds is something we all need to make sure this project moves forward. Now, ladies and gentlemen, to also address us, we have the General Manager of Ghana Cooperative Pharmacists Credit Union Limited, Moses Agbazuge. Please, let's welcome him with a round of applause.
Good afternoon. Mr. President, Madam Deputy Minister, I stand on all the existing protocol once again. My name is Moses Agbazuge. As said, I'm the General Manager for the Pharmacists Credit Union. The SEAPS project is a funding project. 39 years ago, the founding fathers of the credit union knew that there's going to be a day that pharmacists need money to fund their projects. And they put in the structures for the credit union. And it has been 39 years of the Pharmacists Credit Union, and we've grown from strength to strength. In the light of the SEAPS project, in July, on the 11th, there's going to be the launch of the credit union newest project, which is the corporate member. What is the corporate member? The corporate member is the ability of the credit union to finance deals to the tune of 500,000 for each member. It has its own conditions that will be attached to it. But the onus lies on us pharmacists to take advantage of this corporate member initiative from the board led by Farm Richard Achampo. He sent me this afternoon to tell you that he's fully aware of the project. He's ready. He has made funds available for all pharmaceutical agencies and pharmacists who are ready to partner us to go into this SEAPS project. I'm here to deliver this good news to you that he's made available from 100 to 500,000 cedis for each corporate member that will be enrolled into this project, into the SEAPS project. So without much ado, I would like us all to take advantage of it. As the Zulus will always say, Vocus and Zela. Take advantage of it, wake up and do it yourself. Mr. President, Madam Deputy Minister, thank you. Thank you for the audience.
Thank you so much. Ladies and gentlemen, up next, we have a gentleman who is actually going to give us a presentation on the role of technology in a pharmacy business. Please, this gentleman is a healthcare technology consultant with over 20 years of experience in healthcare, with emphasis on the pharmaceutical supply chain. Please help me welcome George Kese with a round of applause.
Thank you, ladies and gentlemen. Once again, all protocols observed. My name is George Kese. I'm the CEO of Advanced Pharma and the technology partners for the SEAPS project. My very first thanks goes to God Almighty for making this day possible. And my very sincere thanks goes to the chairman, our president of the Pharmaceutical Society of Ghana, for his immense support and also his determination to make sure that pharmacists, especially young pharmacists, benefit from this project. And I'm really grateful for his immense support to make sure this day is possible. Thank you, Mr. President, for your duty there. Please, a round of applause for him. And also for the Deputy Executive Secretary, Dr. Awiti, for also his commitment to make sure that this day is possible. I'm grateful to all the partners, especially EcoBank, for their immense support so far in making sure we are here today. I'm here to present on the role of technology on the SEAPS project. And the reason why we are here today, why the SEAPS project. I'm going to speak a bit on what, please, if you can project the slides. So I'm going to first introduce what the SEAPS project is all about, how we made sure that it covers the essential components of the strategic plan and also the needs of the community pharmacists in practice today. And especially I'll focus on the role of technology in how we ensure that the project is going to work for everybody. So I've titled, I think I need to come down a bit. So I've titled my presentation, it's a very short presentation, Innovating Technology to Improve Financial Access for Medicines for Pharmacies. And the reason for this title is because the current situation of accessing pharmaceutical care in the community pharmacies is becoming a bit unsustainable, especially due to lack of financing mechanisms. And the reason for this is not far-fetched. Most of us who are in the practice are aware of the current credit system whereby you either have cash in your pocket or you have a short-term credit with a supplier for the supply of your medications. Suppliers also have a limit to how much credit they can give. So pharmacies are always under pressure how do they manage their stocks and replenish their stocks, at the same time be creditworthy. So the idea of SEAPS is, one, to ensure that there's financial access for all community pharmacies as the oil of growth for their pharmacy business. So at any point in time, if you need financial access at any time during your business, you should have access to that financing mechanism through any of the partners that we work with. And they all have unique products suited for the pharmaceutical sector. So based on your needs, you are able to access that as your help. The reason for SEAPS is because, looking at the future, about 70% of Ghanaians over the age of 40 are going to be living with one non-communicable disease or the other. That means almost 7 in 10 of us are going to be taking medicines every day for the rest of our lives. And that's how important pharmacies are going to be in our healthcare sector. So the call to make pharmacies a primary healthcare center is in the right direction, because the future is going to be heavily reliant on pharmacies as a point of call. That notwithstanding, there's also going to be a need for more clinical services at the pharmacy. So the pharmacy is no longer going to be just a point of getting medications, but a point of accessing basic healthcare needs, especially needs regarding chronic diseases. So it is becoming even more important that data on that kind of service is captured, and captured in a validated way. So that is very crucial going forward to make sure that pharmacies can act as proper healthcare centers or primary healthcare centers. Move to the next slide, please. So what are the key challenges that affect the dispensation of medications at the community pharmacy today? One of the challenges, as I've mentioned already, is financial access. But aside financial access, there's also a lack of coherent data on what is going on within these pharmacies. Because every pharmacy has a different system of operation, a different standard of operation, and a different way of doing business. Meanwhile, they all trade in the same products. So the incoherence in data and nature of business is a stumbling block to financial access. And that is one of the key challenges that we identified. The third is the fragmentation in the supply chain and how they access their medications on the market. And through the use of technology, we realized there's a way we can pull all the pharmacies together on one platform and give them transparency in the way they manage their inventory, such that there's confidence in the business that they are doing based on the transactions that are ongoing within their pharmacies. The actual benefit of the pharmacy is the margins that they make. So it is important that they control, one, their cost of acquisition, so that their margins are not affected in the way they manage their inventory. And that is very critical in the sustainability of our pharmacies. So in deploying the technology, next slide. We looked at how the current challenges affect the service that is being provided today. And one of the key challenges that it brings is stockouts, where if you go to the pharmacy, the drug that you need either is not there, or even if it's there, it's too much of a price for you. Especially when you need it, it's not available. And you don't even know when it's next going to be available. In that case, the patient loses trust in the pharmacy loses business, and meanwhile the stocks are sitting somewhere expiring. So one of the key challenges we have currently is even quantifying the amount of medications that expire on our market every year, because we have no idea how many of our pharmacies are holding stocks that expire every year. So that level of transparency is very important. And to be able to overcome that, we need to deploy the right technology. And that's where the SEAPS project comes in. So we deploy technology to enable pharmacies overcome certain key challenges, and which also help open up opportunities for better services in other areas. Please, the next slide. So what is the SEAPS project? It's a collaboration between the Pharmaceutical Society of Ghana and other key partners like financial institutions, suppliers of medications, and we as providers of digital technology. And the whole idea is to deploy the interest and the leverage of all these partners to make sure that pharmacies are getting better service and consumers are getting medications at a more affordable rate. So that is the whole objective of the SEAPS project. And in doing that, it is hopeful that in a few years' time, we would have modern pharmacies with modern digital services operating throughout the country. One of the solutions that we expect is to have very efficient pharmacy management systems managing our inventories in our pharmacies with modern technology like barcoding system, RFID, and other devices. We also expect that pharmacies would be able to trace and verify their medications that they dispense in the pharmacies. Currently, our system offers traceability for all medications throughout the supply chain. Hopefully, we would work with the FDA to be able to do verification for those medications also. But you can trace every medication throughout the supply chain on the SEAPS platform. Also, we expect that pharmacies would now be able to have access to very cheap sources of funding for their inventory and flexible terms for their inventory, so that when you go to a pharmacy and there's no drug, the drug you need is not there. You can have it within 24 hours because the pharmacy is able to purchase it on time from a distributor on the platform. Please, the next slide. So these are the values that we expect from the SEAPS project for our consumers. I've mentioned some of them, but the key one, which I'm really interested in, is the ability of pharmacies to offer better clinical services as primary healthcare centers. So now a pharmacy can take certain basic diagnostics and be able to offer services that they can document and can be verified so that that service can be quantified. And therefore, it allows institutions like the NHIA to be able to reimburse them for those services. So for us, that's a very key part of this project. And it allows pharmacies to start acting as primary healthcare centers, which they should be. The next slide. So what exactly is the technology that we are deploying for the SEAPS? One, we have a full traceability system from the manufacturer to the consumer. And all this technology is locally developed. So it is able to manage and trace every product that occurs in the supply chain. So for example, the FDA usually issues out recalls for some products based on the batch numbers. Now, currently, you would have to physically walk into every pharmacy to be able to inspect the batch numbers on the products to do that recall. With our SEAPS project, the FDA can recall products very simply by just having a tracing system on the products in the platform. We also have a system of financing management, where you are able to manage the financing of your pharmacy seamlessly based on your suppliers, your creditors, and those that you owe. So in short, the SEAPS is here for the pharmacist and it's also here for the patient and also for suppliers, because now as a supplier, your stocks do not get stuck at the pharmacy whilst you are waiting for payment, and your receivables are no longer a challenge because you get paid when you make supplies to the pharmacy. Therefore, you have easier cash flow, and you are able also to have your stocks taken care of in time. Thank you. I'll stop here and take any questions or any queries. And we are open to do business with any representative who is ready for any of the financial institutions, any of the suppliers, and any of the, any of the banks. Thank you very much. Let me acknowledge the Pharmacy Council chairperson. We hope to be able to have a round of series of meetings with the Pharmacy Council to see how best we can collaborate to make sure that this project is a success. Thank you very much.
Okay, thank you.
Thank you very much. I just want to inform you that the ministry is also collaborating with FDA for national traceability. So I think we should talk so that we are at a very developmental stages. There's a need for us to talk. I'm very happy that this can be traced down all the way to the community pharmacies. Currently, we are working with the Manufacturers Association, the PMAG. And it's a very, very huge. We are looking at an end-to-end traceability, so maybe it's the right time. So I think we will sit down and talk so that we'll see how we can form, together develop one system for Ghana. Thank you.
Yes, we need more collaborators, so thank you very much.
Okay, so we are going to be taking the question right after our rep from EcoBank speaks. So please kindly bear with us. Ladies and gentlemen, next to give us a presentation on financial requirements of a sustainable community pharmacy, please help me welcome Michael Amwa, Senior Account Manager and Sector Lead for Health, with a round of applause.
Good evening. Deputy Minister of Health and the President of the Pharmaceutical Association of Ghana. Permit me to stand on all protocols that have already been observed, and to thank you very much for coming. And for us as EcoBank, we are proud to be associated with this project. The reason is that we believe that for a community to prosper, for our people to benefit, the communities in which we operate, for them to prosper, we need to be healthy. And that is why we believe that there is a better way to a healthier Ghana. And for us, we also believe that providing financial solutions, solutions that help community pharmacies to provide the needed care for our people is important. And so that is why we chose to host this program here, to graciously allow the Pharmaceutical Society to come here free of charge, because we believe in the project, and we want to support the project to its final conclusion, and for as long as we are here. So for a community pharmacy practice to prosper, one of the ways for them to prosper is to be able to pay their suppliers on time, so that their credibility is held intact, isn't it? And so we have provided solutions that will enable community pharmacies to pay seamlessly. One of the solutions that we have provided is our OmniLight platform. That platform enables pharmacies to pay in real time to their suppliers. You are able to pay your bills, you are able to pay your employees with a click of a button. And that enhances efficiency and turnaround that enables the pharmacy to progress. And so we believe that With this partnership, that solution will enable us procure the needed medication and to allow our pharmacies to operate. Another solution that community pharmacies need in order to sustain their business is the money. You have to collect the money. You have to plug leakages. You don't want monies to go into wrong hands. And one of the ways to ensure this is to have a digital means of collecting. And that is where our POS comes in. Our POS is able to accept Momo. So you can do Momo on the POS. Okay. And we also have a GHQR, which you can also scan and pay on the Momo. And that enables you to be able to collect all your money and ensure that there are no leakages. Because it is also Android in nature, it is easy to use. We can train you. We have people in the bank that are trained to help community pharmacists and their supporting staff to be able to deliver on this project. So collection is very important, and we have made that solution available for our customers. Another solution that we have put in place, I don't know if the screen is up already. Okay. That's unfortunately my system is gone off. So permit me to come here to look at the next slide. Another solution that we have put in place is our pay with solution. With this pay with solution, it enables you to collect payments without the use of contact. So it is just like Momo, but this time it terminates directly into your account. So the money goes into your account directly, and you don't need to go to the bank for the bank to transfer and all that. No. That is one solution that enables you to collect your money quickly and be able to buy, restock, and be able to sell to your customers. Again, we have also made available financial solutions that help with our customers. And this is where I think all of us are interested in. We provide working capital for community farmers that enable them to stock. For those who also want to expand their facilities, we provide facilities in the form of term loans that enable them to expand in terms of construction and other things. If you also want to buy a vehicle that will enable you to distribute medical medications, yes, we have the term loan that will enable you to do that. On top of this, if you are a woman that is leading the pharmacy or the business, we are giving you preferential shares, treatment. When it comes to interest rates, we give you preferential treatment. When it comes to collateral, we give you preferential treatment. So if you own the pharmacy, if you lead the pharmacy, if you employ 30% or more females, we give you preferential treatment, preferential rates, preferential collateral. And on top of that, we provide training for our lady pharmacists and leaders who lead the business, and in terms of bookkeeping, in terms of coaching, mentoring, and other financial skills that we provide. We provide them for free for our lady customers or pharmacists. So in a nutshell, I'd like to say thank you very much. These are products that we offer, and we are available all the time to provide you with additional information and to ensure that this project succeeds. Thank you.
Thank you so much. Please, let's do it better for the gentleman. At this point, ladies and gentlemen, we have all the resource persons here. They will be taking your questions and answers. So we are making room for only 4 questions. So I have a first gentleman with his hand up. Quickly, let me come to you.
Thank you very much. Okay, very straight to the point. Okay. So my question is to the regulated Pharmacy Council, first of all. Why is it very difficult for the regulator to set rules that all pharmacies are owned by pharmacists? It's quite difficult. When you go to a neighboring country like Cote d'Ivoire, pharmacists own pharmacies. My second question is to the SEAPS project, the president and Mr. Kese. In your presentation, you were talking about the sale of medication, tracking of inventory and everything. Now, after you've sold the medication to the patient, that management there needs to be a pharmaceutical service. You need to manage that therapy. Does the SEAPS project have any feature or a place where we can have access to telepharmacy, where after you sold the medication, we can manage that therapy? So these are my questions. Thank you.
So this question is actually directed to, okay.
I'm not here to answer questions for the Pharmacy Council, but I'll try this one. I hope it works. If you look at our history, Mr. Dr. William Addo alluded to the history. If you listen carefully to him, pharmacy started off not in a very straightforward way. Okay, so before we could actually get hold of the profession, as we did during the Mr. T.C. Kwokwe's time, okay, there were a lot of players in the business. If we have to do that now, it's possible, but we need everybody on board. It is a political decision. We need to lobby Parliament. We need to lobby the Parliamentary Select Committee on Health, get them all on our side. And then if a law is passed to that effect, then it's possible. So we all have to come together to get that passed. In the Francophone area, it's very, very simple. I worked in the Francophone area for close to 10 years. Very simple, straightforward. If you are not a pharmacist, you cannot own a retail pharmacy, okay? Even with the wholesaling, there were 3 types of wholesalers. There was the main Laborex. Laborex is the French concern. Then you had another association of all pharmacists. It's something like the credit, what we had as the cooperative. Yes. If you were not a pharmacist, you couldn't be part of that. You owned a part of it. So the business, even though you are in retail, you own a part of the wholesale and everything. It's there. If they sell a product to you, they tell you how much you should sell it. So from Accra to Tamale to everywhere, it's the same price. So it needs to be regulated, and we need political will to do that. Thank you.
All right, thank you. Any other question, please? Any other question? The second question, yeah. Mr. Kese, please.
Okay, I think your question was on patient management after sale. Yeah, so the system is a full pharmacy management system. What do you mean by pharmacy management system? There's a patient management component, a clinical patient management component, where there's patient retention features. So you can reach out to patients who are on chronic medications, offer advice, counseling, well-documented counseling. Basically, what this system does is it translates every paper prescription into a digital prescription and translates it into a label. And that label comes with instructions. So those instructions are documented as part of the service the pharmacy provides. And those instructions can be in the form of counseling, can be in the form of so many other varieties. But that can be continued after the patient has left the facility.
Okay.
Just to add up to what Madam Chairperson's response, I just want to add to it. I think the French-speaking countries, there are about 21. It's a union. They come together every year. I joined their meeting one time in Cote d'Ivoire. This year, most likely to join their meeting in Togo. They are actually worried about English Africa, why community pharmacy or retail pharmacy is actually in the hands of businessmen and not pharmacists. But that's, Madam said, is our history and the law. You know, they were more or less, because of Francophone, the French, helped them. But there's a way we can go about it. And I like what Madam Chairperson said. We can work on it and get the laws changed for community pharmacy to be granted, a license to be given to only pharmacists. But then you can't go back. It will only be new applications. Those who have already established themselves will have to still be in the community pharmacy business. If even today we pursue it, we can only say that all new applications must belong to only pharmacists. That is more rational, and that one we should be able to get Parliament and our politicians to be able to help us get that done. But you can't go back to punish those who are already in existence. Thank you.
Okay. Please, any other questions? Any other? Okay.
Hello. So my question is with financial. My question is with the financial support for opening pharmacies in underserved areas. So since in those areas, the purchasing power isn't really high, and then pharmacies will not be very profitable comparing the profitability over there and also in bigger cities. The financial, with the credits, deeming them credits worthy, and then with the financial support being given to them, is there a component taken, is there a consideration over there with how much they'll be making over there compared to conventional people in bigger cities? Because then there'll be some disparities and then it won't be the same. Thank you.
Mr. Kese, please. Okay, then add it to it and then we can just...
All right, so one of the key challenges with access to pharmaceutical services in Ghana is the unwillingness of most of the professionals to move into the deprived areas. So how is the SEAPS project going to address that particular challenge of people not willing to move to deprived areas?
Thank you. I think both questions are related, so I'll take both. So frankly, every pharmacy is profitable everywhere, depending on how you manage the pharmacy. There are chemical shops in those areas you are talking about who are very, very profitable. And the reason they are profitable is because of the way they manage their business. If you know how to stock what is needed, you get the demand for it and you make your margins for it. The challenge is knowing what to stock where you are and what you need for your people that you need it. That's where data is very important. So the whole aspect of part of this project is to make sure that those who set up in those deprived areas have sustainable business tools they can use to manage those businesses well, so they can make profits. Because you can make profits wherever you are. That's my answer to that. Thank you. Yes.
It's true, profit is essential, but with this project, finance will be needed. You need the money. Concept is that we want the pharmacists to get in there. Let your presence be felt. Start offering your services. Don't put the money first. If the moment you start looking at financial interest and returns, you won't get anywhere. But trust me that if you go in, the first year you may not even make so much profit. It could be second year, but eventually you would win. That is why you need to be dedicated and committed to that cause. Remember, it is your pharmacy. Whatever we do for you to help you to move into such a deprived area, it is yours. The fulfillment there. There's a lot you can do. extemporaneous preparations, meeting your patient clients, building the clientele around you, word of mouth to go out. There's this young pharmacist here. There's this pharmacist who's now come here. The way you manage conditions, your professionalism, it will tell, and you will succeed eventually. Pharmaceutical Society of Ghana is not going to leave you just like that. That is why it is a project under the Pharmaceutical Society of Ghana. We would see how we would partner with you throughout the process, because until you finish paying off all these loans, we can't leave you. So we are with you. If the financing authority, the financiers are giving you the funds, they are giving it to you because they believe you're a member of the Pharmaceutical Society of Ghana and you are going to be responsible. All the agreement to be signed. So we'll be there, we'll be giving you all the needed support. Financial management training will give you the support. So you must bear in mind that you cannot make it just like you open in the first month, second, third month, you want to make it big. You must be dedicated to actually offer that service. That is why we use the word pharmaceutical services. Let's put the services first. The financial reward will come. As we speak, we are lobbying. We are pushing very hard for NHIA to accept pharmacists to give several services. This week we met with the NHIA management team. NHIA granted, you're already there. You can now treat a lot of patients and you'll be paid for the services when they come to you. But if you are not there, how can we even do the advocacy? That is why we need you to position yourself everywhere. So don't look at it first from the financial point of view. Look at it from the pharmaceutical services, and the benefit will come. And we would be with you where we need to support you. We will support you to ensure that you succeed.
All right, thank you very much. I see a hand over there, so I'm going to quickly go there.
Thank you so much. My name is Kofi Juma, a journalist. Sir, I want to ask, don't you think you are taking the job or the businesses of the over-the-counter drugs operators? Thank you so much. Because you are going everywhere. Almost every corner of this country, you will be going there. So don't you think you are taking their businesses? Please, thank you so much.
So, please, who is the question directed to? Can I get someone to support me or help with that? Anyway, you support me. Anyway, interesting. First of all, over-the-counter medicine seller is a conditional license given. Check the law, Act 857. A deprived area where pharmaceutical services are not available, then you are granted a license. When the condition ceases, the license can be withdrawn. The law makes it clear. If a pharmaceutical service was there, you shouldn't be there in the first place. So it is not a question of we taking their jobs. We were not available in those areas, and we give them the opportunity to provide a limited service. A service limited to only Class C medicines, emergency medicines. But here comes a pharmacist who is come to offer the comprehensive service, Class C, Class B, Class A. This is what we call pharmaceutical services, not the limited service of Class C medicines, which are usually known as over-the-counter medicines. So that's not exactly what we are doing. Chairperson of Pharmacy Council want to add to that.
That's a little addition. When we grant a license, it's for 1 year. Every year you have to renew. So it can be withdrawn at any time. That is what everybody should bear in mind. Even for the pharmacy license, it's for 1 year. All licenses 1 year, and it can be withdrawn at any time. Thank you.
Okay, thank you. We are taking one more question, and that will be it for the day. I believe our keynote speakers have their doors open to you anytime, and you can walk into their offices and get any questions you want answered. So the last question, please.
Thank you very much. I think we are done, right? Good. So permit me to do the vote of thanks.
Okay.
Yes.
To the over-the-counter medicine seller question, it's important for you to note the Pharmacy Council is encouraging them to upgrade. And currently, a lot of them are being given the opportunity. Just upgrade to pharmacy so that you can provide the pharmaceutical services. But so they have the opportunity. So we are going to work with them for those who want to upgrade, hire the service of pharmacists and able to provide pharmaceutical services. We would support them to do that as well.
Thank you, Mr. President. And also to add that, you see, medicines are not ordinary items of commerce. And for somebody to go to school to study about medicines, the formulation, how it works, for 6 years in the uni, okay? compared to somebody who, just because there's a need in the area, in the village, then because of that provision, the Pharmacy Council has to train people to be able to meet that limited need, trains that. Which one will you prefer? Okay, good. So that's why it's important that over time we are able to expand pharmaceutical services and pharmaceutical care even to the deprived areas, because now the numbers are encouraging. So that you don't want a new medicine that has come, that the pharmacist knows, has learned about, which is doing magic, but which has a narrow therapeutic index. For that matter, the balance between the benefit and then the harm is very small, which means you need to pay attention to it, because medicines, pharmacon, it means something that can harm and also can heal. So you need the experts on medicines to be able to administer the pharmaceutical care. Okay, thank you very much. So having said that, I just want to take this opportunity to thank profoundly EcoBank for giving us the opportunity to be here. For those of you who received the earlier invitation, you realize that we're supposed to be at Labadi Beach Hotel, and just yesterday we had to change to here. And you wouldn't know the setup. For somebody to agree within less than 24 hours to set this up, I think they deserve another round of applause. And to the Honorable Deputy Minister, MP for Beposu Kwama Nsuta. Okay. Yeah. Okay. Thank you. Yeah, the Frakra and Katemkwai. Thank you so much for being with us. You are now a friend of the human race. And we say amicus humani generis. So, and for all our dignitaries who came, from the chairperson of the Pharmacy Council to Dr. Dominic Ochery, who represented himself, as well as the Director General of the Ghana Health Service, who is away at the World Health Assembly, as well as the Minister. The Director of Pharmaceutical Services, Dr. Aziz, thank you so much. Our father, the President of the Pharmaceutical Society of Ghana, whipping our back to make sure this is done. It is done. Piwa, President, thank you for being with us. We thank you, Dr. William Edumado. And CBPA Chair, President says the work now starts. So even though the members are not yet CPA members, you have to support to get them, because they are your potential members. So Dr. Ireland, thanks for coming. And for all the governing board members who came from Takrade, we have Dr. Zika. He came all the way from Takrade. He's a PSGA chair for Western Region. Then we have the PSGA chair for Central Region, Abna Ekufua Esiadonko. Thanks for coming. For representatives of worldwide who were on board even before we started, they are willing to partner us to supply medicines to all who will come on board. And for that, we are grateful for that commitment. Thank you for coming. Thank you. Our credit union, you are with us. So that one, FIASM, Rector Ghana College of Pharmacists, and everyone present, the media especially, thank you so much. I invited very few of you, but I realized that I have a list of over 40. I don't know what I'm going to do it for it. Do with that. So please help me. And Medical Credit Fund here. Say we've been together since the earlier days. So Dr. Entry, your team, and our new manager, Dr. Hansen, thank you so much. And to everybody who came, God bless you all, and help push the SEAPS agenda forward. Thank you for coming.
All right, thank you very much. With that being said, ladies and gentlemen, our partners that made sure this has been possible, we want to acknowledge you. Medical Credit Fund, we say thank you so much. EcoBank, we say thank you. UBA, Prudential Bank, Ghana Cooperative Pharmacist Credit Union, we say thank you. And then Worldwide Healthcare, okay.
My deputy, the one in charge of the strategic plan, who had to swear to take this through. Harry, let's see you. He's a strategic plan manager, and under whose direct domain this falls. So he's worked hard. He's not slept for a couple of days. So today you sleep. Thank you.
All right.
Dr. Paul Donko is the chairman of the strategic plan coordinating committee. He's away in the UK for postdoc something. So he will be back, and hopefully he's joining online. Doc, we acknowledge you. Okay.
All right, thank you very much. Ladies and gentlemen, it's been a good time with all of you. Oh, okay, to all those of us watching online on our Zoom platforms, we say thank you so much for sticking with us. We appreciate it. And ladies and gentlemen, we are not going to leave you like that. Those online, this is not for you. We have an item 13 outside waiting for us. Immediately you exit, make sure you grab something to eat. It's been hours here, and I know some of us are famished, so please do well to grab something and eat. My name is MC Dela, and thank you so much for making this possible. We would want our invited guests to actually come forward for some pictures, and then also the media. The media, this is the time you can actually approach and do all your necessary interviews. Thank you. Okay, so we have the media wall outside. If you want to take any pictures there, just to keep this memory. Just to keep this memory, you can go there. But in the meantime, our dignitaries, please kindly join us.